You are the Canadian Donation and Transplantation Research Program. You are CDTRP.
The CDTRP is a network of more than 400 clinicians, senior, mid, and early career researchers, trainees, patient, family, and donor partners, and 100 partner organizations. Our network has supported 275 collaborative research projects and has mobilized research into policy change, legislation, commercial products, and improved knowledge for patients, families, and donors. Every year, CDTRP supports between $30 to $40 million in grant applications, something around 60 to 70 individual applications. You are CDTRP. These achievements wouldn't be possible without your hard work.
CDTRP Research Services is a platform that supports principal investigators to develop high-quality research in donation and transplantation. We work hand-in-hand with CDTRP investigators to maximize the effectiveness of research teams through support with funding development, project management, patient, family, and donor partnership, knowledge mobilization, events, and trainee support. Across the 5 research themes, we help teams mobilize new knowledge to ensure patient, family, donors, healthcare systems, partners, and stakeholders equitably benefit from research results.
If you are a basic scientist and would like support with your knowledge mobilization plan, if you are a busy clinician scientist with limited time for research but would like to run a multi-site study, if you are an early career researcher and looking for collaborators to help with your grant applications, if you value patient, family, and donor engagement but are not sure how to find the right patient partners or what role they will have in your project, if you don't have full-time research staff but need support,
we are here to help. Our experienced management team can support you at every stage of your research in donation and transplantation.
Now you are probably thinking, how can I request CDTRP Research Services support? The answer is simple. Go to the CDTRP Research Services Platform website, fill out the form to request support, and we will get in touch with you to discuss your needs. That's it.
We.
No.
Noi.
Nos.
Emis.
Nosotros.
Menk.
Kiano. We. Kiano.
Our CDTRP, and we will drive research advances so that every wish to donate is fulfilled and transplantation becomes a lasting and sustainable cure.
You are CDTRP.
Email us today.
Welcome back, everyone, to our final 2 sessions of the day and the conclusion of the 5th edition of the CDTRP Patient, Family, and Donor Research Forum. So I'm excited to introduce you to our next 3 presenters who will discuss Project Heart, a collaborative exploration of the future of engagement. Presenting today are Sarah Douglas, who is Policy Analyst at Health Canada She co-leads Project Heart with a team of community members with lived experience, researchers, designers, and policy analysts with a diverse experiences in the healthcare system. We also have Nadine Hare, is a design mentor who helps teams embed design and participatory research in their work. She teaches design research at OCAD University and at the University of Toronto. She also serves as an innovation fellow at Women's College Hospital. And finally, we have Manuel Escoto, is CDTRP's Director of Patient, Family, and Donor Partnerships and Knowledge Mobilization. He's been with the CDTRP since 2021. He is also a 17-year kidney transplant recipient. So I hand it over to you.
Thank you, Len. Perfect. There are slides. So yeah, good afternoon for me. I'm in Ottawa and I'm really excited to be here. It's funny with the name Project Heart, it's actually both literal and metaphorical. So literal because this work was really inspired by my time as a secretariat for a group at Health Canada, patient and advocate group for organ donation and transplantation. And some of my mentors like Christy are here on this call this afternoon, and I'm grateful for them that they inspired this work and also introduced me to this great community that I'm proud to be presenting at here today. Next slide, please. So today we're going to be talking about co-design, and right away I wanted to share one of the outputs of our co-design experience, this beautiful land acknowledgement that was guided by two of our collaborators, Mary Bocage and Kathy Wood, and they shared their knowledge and also guided us to some really helpful resources to help design this for us. So the resources that I found particularly helpful were the ones from the CanSolve CKD website, the beautiful video series they have, also other websites like Native Land and Whose Land. So I continue to sort of learn about my surroundings and to have gratitude for the land around me that I work, live, and play on, which is the traditional territory of the Algonquin and Anishinaabe people. Next slide, please. So mentioning our collaborators, this project was funded by Health Canada. It involved many people. It was very, I would say, positioned in a space in Health Canada where it really was employee-led, and we were able to sort of not operate as an arm's length, but that we were able to make the decisions at a grassroots level to make the project what we felt would be really authentic to the participants. And so this really involved many people, including community members, people with lived experiences, researchers, designers, and policy analysts. And I know that, again, I recognize some names that are here today of people who contribute to this project. So while there's only 3 of us on screen, myself, Nadine, and Manuel, really the findings and the outputs of this project wouldn't exist without the stories, the labor, the care, the participation of all of these people that you see on the screen in this list here. And one very special collaborator, I saw, the beautiful speakers from this morning that spoke a lot to this and also about Mary. So of course we wanted to take a moment to acknowledge Mary because she was such a big part of this project. And I think if she was still here with us today, she would be presenting alongside us. She was an interviewee of the project. She was a co-designer and she was a facilitator in some of our small group co-design sessions. And we just really want to take a moment to share the impact that Mary had both on the project and us personally. I love this quote from Mary. It really spoke to the heart of what we learned in the project, that 65 to 75% of the work is building relationships and 25% of the work is actually doing the work that you are setting out to do. And, I know that Carmen spoke of this earlier today. And I think for me, just this, Mary constantly reiterating this throughout the duration of our project, really taught me, especially as a government employee, the importance of slowing down, investing in relationships, really considering what the people outside of government need from you. But I also think about sort of having healthier relationships internal to government with my colleagues. And that really we can only progress if we're open to learning and trying new things and learning from the people that we are in relationship with. And I also appreciated Mary's sort of support and acknowledging that we make mistakes along the way, and that's okay, as long as we're sort of accountable to ourselves or accountable to those that we're in relationship in, and as long as we reflect on the lessons that we're learning, particularly in the space of engagement. But I'll pass it over to Nadine to share how Mary affected her.
Thank you, Sarah. Just to build off what Sarah was saying, Mary brought such a joy and care to the work we did together. I learned a lot from her. I wasn't expecting to go in learning a lot more than maybe sharing. And she really regrounded us continuously in what was most important from a place of joy, care, and openness. And so I take that with me into all the work that I do now and feel very grateful for Mary's teachings and presence.
Manuel, would you like to share?
Yeah, I can quickly jump in here. You know, I found myself saying this last week at a different event, and you know, my coming into this world of patient engagement is relatively new compared to some folks on this call who have been at it for decades, and Mary was one of those people. And from my first step in patient engagement, you know, throughout all the years, I found that Mary was always there. She was there providing leadership. She was there providing me with peer support. I think I have a tendency where I think I have to, you know, be perfect and probably overthink many things in life. And Mary was there to provide guidance when I wasn't sure on how to say certain things. Mary was there, and she just always had my back, for lack of a better word. And this piece about partnerships is so key. That is a foundational principle I take in my work here with CDTRP, but also in life. Building partnerships, building trust, building that accountability with the relationships that we have, I think is so important in the work that we do. And Mary was there. Mary was a prime example of that. I know she was very much loved and is very much missed by the folks on this call. Impacted many people within CDTRP, Cancel, as you mentioned, Kidney Foundation. She was everywhere, and she was such a guiding light to so many people. So she's missed, and thanks for providing the space to talk about Mary right now, Sarah, Nadine.
Thanks, Manuel. So the context of Project Heart. So you can go to the next slide. So working in government, I noticed that we are in sort of this moment of cultural change, right? So at Health Canada, we've learned that engagements are sort of no longer just nice to have. They're actually such an important process of when we are building programs, building policies, evaluation. And so therefore, you know, this is kind of, you see it often in kind of the external to government, but it's really becoming more and more common in government. And as a result, there's a lot more sort of working groups or committees or councils that include people with lived experience. However, kind of, as I said, with my experience of in the ODT space, and then talking to some of my other colleagues in different areas of like mental health or drug use, or, you know, all the kind of the vast federal government files that we have in health, it became clear to me that we just sort of knew when we led and get engagement, sort of what we needed to get out of engagements. We were very much entrenched in what do I need to do? Why am I doing this in order to get what I need done for what I've been tasked with? So whether that's a report, a policy brief, you know, a program evaluation. And then when we sat back and thought about it, it was like, you know, what do the people who we're engaging, what do they need? How do they want to be engaged? Do they feel that what we're doing is meaningful? Do they feel how we're going about it is leading to something that's actually impactful? So with our project, the project goal was really to try to remedy that, was to sort of say, okay, we need to understand engagement, not just from us and what we need, but from the perspective of people we're engaging. So in this case, we're talking about people with lived experience, and really how can we make the engagements meaningful, inclusive, and impactful for everybody involved, not just for, you know, the policy analyst that's going on about their day-to-day work. And so we did this by starting with an environmental scan that sort of looked at the state of engagement across the different provinces. And then we interviewed people with lived experiences to hear about their perspectives on engagement. And then finally, we sort of brought those two groups together in a co-design sessions for both people with lived experience and policy analysts to sort of talk about how can we move forward, what does an ideal future look like for engagement, and to kind of co-design our final recommendation.
So what did we learn? So you can go to the next slide. Thank you. So the first thing that became clear to us is that there was this foundational tension between how people spoke about what an ideal engagement was versus their past engagements. When speaking about ideal engagements, when speaking with people with lived experience, they spoke about collaboration, partnership, trust, and strong relationships. But then when we asked them to recall what their experience had been of past engagements, people often spoke about feeling as though they had been engaged like a checkbox activity, or that their engagement was inconsequential or even tokenistic in exercise. Interestingly, policy analysts also felt uneasy with the way that engagement was being done. We heard that they felt as though they were stuck in a method and process that didn't serve them, or they felt really unsure about what getting it right meant or looked like. So there was this really interesting tension that showed us a space for improvement and innovation. So a few quotes here to bring that to life. We heard people are not really engaged, not respected, not usually utilized to their full potential. It's a big turnoff and it hurts people. It actually creates trauma, right? And that was from the perspective of people with lived experience. From the perspective of policy analysts, we heard it's difficult to balance out where you find there's real added value to engaging people, to what extent you need to engage people so they can make sure that you can keep them safe, and making sure it's not just tokenism. So this seems to not be fully working for everyone. So on the next slide, just outlining the main learnings, really, and coming back to Mary's quote, which was so pivotal to this research and to this project, is strong relationships are at the roots of meaningful engagement. In other words, meaningful engagements are less about following a predetermined checklist or about the specific tools that you're using. Are you doing it online? Are you doing it in person? Are you doing this activity or that activity? The specific tech or maybe the methods used. Instead, meaningful engagement is more about building strong relationships that lead to true and caring collaborations. So this learning was really pivotal to us. It said, although guidelines are pivotal to creating change on their own, what we learned is they can sometimes reinscribe the very problem we're hoping to solve. So guidelines are created from a place of care and hope and desire for something better, but sometimes they actually just become another, or start to become and feel like another checklist for people. We were reminded about this throughout the project repeatedly. For example, in one of our co-design sessions, we were thinking of ways in which we could ideate guidelines around what good communication would look like during the engagement process with people with lived experience. So when do people want to be communicated with? What does that communication look like? And as we were ideating, many of the co-designers kept on reminding us that good communication wouldn't come from simply telling engagers to ensure that they're doing a set of actions. This is important, we learned, but on its own, these prescribed actions can start to feel like a box checking exercise. And then again, leave people with lived experience feeling tokenized once again. So another way of thinking about this, actually, if you go back to the previous slide, is that there are sort of two key elements to meaningful and impactful engagements. Yes, we need to change how we are doing engagement and really embedding that care and deep relationship building within it. So we've outlined some preferred approaches on how we can change how we do engagement, but we also need to change the way we think about engagement. And these are the mindset shifts that I'll spend a little bit more time on building out. Yeah, the next slide, please. So thinking about how we think about engagement versus just how we do engagement, we co-designed 4 key mindset shifts that we learned were really meaningful and important to bring about a shift in how people experienced engagements. When I'm speaking about these mindsets, I just want to be clear, we have on the left here established versus emerging. Established doesn't mean, we're not putting it here to say that established is bad or wrong and emerging is good or the right way. what we're suggesting is that established is the way we often function. It's the way that's been maybe the existing model, perhaps for some time. And the invitation here is to think about what would happen if we open space for more emerging mindsets on the right-hand side, not completely deleting all the established mindset, but allowing more space for emerging mindsets. And how might that shift how we think and approach each other in relationship and in engagement? So I won't speak through all of them, but I just wanted to highlight two of them. The first one is from expert-driven to collaborative. So it's pretty self-explanatory here. So moving away or sort of moving away from an expert-driven mindset where traditional experts are seen as the best poised to make decisions. And the idea in this mindset is that experts know more than non-experts, right? If we were to open up space, or the invitation here from Project Heart is to open up space for a collaborative mindset. In the collaborative mindset, decision-making is most effective when it happens between diverse experts and the people who are impacted by the decision. And in fact, in this mindset, people with lived experience have valuable expertise that cannot be accessed solely through academic training. Another example is from goal-oriented to process-oriented. So in the goal-oriented mindset, which is often the established way, success is viewed as our ability to accomplish project goals. And emerge with rigorous data. That is what success looks like. In this paradigm, we're moving at the speed of the timelines, right? We have to complete this by this timeline, and that is what success means. Instead, the invitation is to open up space for process-oriented instead, where success is based on the quality of the experience of going through a project, or in other words, moving at the speed of trust. So we outline each mindset a lot more in detail if anyone's interested in the final report. I will move to the next slide where we also did put forward preferred approaches. So not only how we think about engagement differently, but doing it. Again, each one of these is outlined in a lot of detail with very specific suggested actions that people can start implementing. But broadly, we learn about relating as collaborators. So people with lived experience are seen as collaborators in the entire engagement process versus just being seen as collaborators at the moment of the meeting or the workshop or the consultation. And people with lived experience have the possibility to co-envision what the engagement itself looks like. Fostering inclusive spaces, so engagements address and recognize complex power dynamics and privilege to help create more caring and inclusive spaces. We heard about the importance of valuing whole people and their perspective, where people with lived experience are seen as experts in their own right, as I mentioned, but are also engaged as whole people with a lot of other skills and knowledge and life experience than just the experience around, for example, living with a chronic illness or living with a donated organ or being a donor. And then demonstrating deep listening and showing impact. So contributions from people with lived experience are heard and included engagement outputs. And this, we really heard about the importance of feeling and being and showing that people were heard, and the potential impact of the outputs are clear from the start. So people know what they're consenting to. And I will hand it over for the next portion.
Perfect. Thanks, Nadine. So really at the heart of this project is the implementation of co-design. And Sandra, your last comments about the having patients right at the beginning being part of that co-design stage was a perfect segue for this presentation. And we've heard over the last 2 days that patient participants and research partners as well, we've been used for our stories, for our data, but we haven't necessarily been put in a position of co-leadership or influence traditionally. And as Project Heart has outlined, there does remain this ongoing disconnect. And Nadine just touched on this. It's that disconnect that we're following, what experts are doing, and not really taking into account what participants and patient partners are wanting to achieve through this. So co-design is just that. It actively involves persons with lived experience and other stakeholders in the designing process from the very beginning to understand what persons with lived experience want to achieve. And it's because this co-design, it's an iterative process. I can't stress this enough. It's an iterative process that requires ongoing adapting, revising of plans, of goals and designs as new learnings emerge. I think this is really a key takeaway for both co-design, but also generally patient engagement, that it is an iterative process. So why co-design? Well, as I noted, patient partners want to be more than their stories. Sharing our lived experiences is important, but it only represents one portion of us. And I'm saying us, and we purposely, as a kidney transplant recipient, wearing that hat right now. And it's one part of us, and we need to dig a little bit deeper when we're building partnerships and when we're going into this process of engagement. We want to be viewed as whole people. And that's really what came out of this whole process. Is through interviews, we learned that participants want to be more than a source of data. We want to be part of a team. We want to help support generating ideas, supporting new strategies, solutions, helping with recruitment and the various pieces that we've talked about over the last 2 days. And what participants really told us about co-design is that we want to be recognized, and we should be recognized. We are experts in this field. We have this unique lived experiences that, you know, others in this space don't necessarily have. And it's because of that lived experience that we can influence certain processes and designs of research, or whether it's policy, building partnerships, community engagement. And really the goal of Project Heart is to conduct research in a more participatory manner. So it really does make sense. I'm going to put you, Nadine, and Sarah on the spot, that you weren't necessarily the ones leading this process. Of course, as organizers, you were, but you weren't deciding on how this project was going to be conducted. You really left that up to participants, both persons with lived experience and the analysts involved that you highlighted earlier. Next slide, please. One more. You might have to. Thanks for knowing that. So really, this slide really provides a visual of the shift that needs to be made, where we rely perhaps less on experts, you know, saying we know better, more towards that co-design piece, which goes beyond empathy, right? Beyond share your story. What's your experience? Towards more meaningful participation and really full integration into projects for those who have lived experience. Next slide, please. I'll do one more. Perfect. So these images really provide a quick snapshot of our activities during the co-design workshop. We can spend half an hour on this, but I'll provide 3 quick lines for you. We hosted 3 co-design workshops to create our final recommendations, which really focused on the envisioning the ideal engagement experience. So first, we held a planning co-design workshop where people with lived experiences and policy analysts co-designed the co-design. It's always a little weird to say, but I was part of that co-designing the co-design. So we went through the process. We talked about what we liked, what we didn't like, how when we brought it forward to other groups, pieces that could make that better, that can build that trust, that can build that partnership, that would make communications easier, that would make it more accessible. So that was a really cool piece. Then we had 2 co-design sessions that focused on generating and refining ideas around engagement with the broader group. And then finally, we had a 3rd workshop that brought everybody together to hear about people's experiences about co-design. Next slide, please. So what did we learn? Well, the overwhelming response really was that co-design was impactful for both persons with lived experiences, but also policy analysts, and that this method of co-designing and then co-designing the co-design really helped build trust and strong relationships. So, you know, at its heart, co-design does build those safe, accessible spaces where everybody is allowed to bring their ideas, where they're allowed to bring action, where there is no wrong answer. And I know we hear that so often, that there is no wrong answer, but this process really allowed that space for that to happen. And we quickly learned that co-design requires a commitment of learning and adapting, not just from the hosts, so not just, you know, Nadine and Sarah in this case, but also from all participants, myself included. Next slide, please. So generally, most participants appreciated the co-design approach and had positive things to say. There's a couple of quotes there that I won't go into, but they generally had positive things to say about the overall atmosphere and time management of the sessions. Participants expressed that they felt heard, they felt valued, they appreciated the opportunity to work with others. But of course, as with everything, there's challenges. So some challenges were highlighted, and really that included having enough time to build those spaces, build those relationships with other participants. Then yeah, that's it on my end. So I'll pass it over to the next speaker.
Thank you. Yeah, so what happens next? Next slide, please. So I think anybody on this call who's sort of in this space, you know that spearheading change can be difficult, and things take time. Change takes time. And I think that especially, we always know how slow things take in government in general, and I think change is sometimes a way that people have been used to working, is also, people can be slow to adapt. But the good news is that I think the power that I see in co-design is the fact that when you build people into the process from the beginning, it's almost like you create these champions, these internal champions, because they've experienced it and they experience the positive and, some of the challenges, but it's like they believe in the process. So these are the people that can become sort of those early adapters within the system to help have those conversations. So we've been doing a lot of knowledge sharing, and we always ask people, sort of what to do with this knowledge. Well, we say that maybe you could reflect on the learnings and really have that quiet time for yourself. What felt challenging, what felt inspiring, familiar, or surprising, and just have that self-reflection of what did this content mean to you and what might it look like in your own space. And then maybe pick a path forward that's outlined in the report, or maybe start thinking about some of the mindsets we presented today and just try to test them in some of the work that you're doing, or even just have a conversation with a colleague to sort of start this, mini movement of moving into this direction of using co-design as a way to engage. And then when you do try something, share your own learnings and have your own conversations, right? Continue to sort of, in design language, like Nadine taught me, it's sort of this idea of prototyping and testing for yourself and having that reflection of say, like, what went well, what didn't go well, what would I do for next time? And you can go to the next slide, please. Because there's we're talking about it today, and this is sort of very container way, but I think some of these quotes that we have in our report and in this PowerPoint is really powerful to say that, like things like healthcare is all about power. It's also been said that only through authentic opportunities to share power and collaborate with shared purpose will we witness transformation. Project Heart is one of those opportunities. I think we can all agree on the fact that there can be improvement in our healthcare system, but in order to do that, we have to change our ways of how we're making decisions in the system. And I see promise in using a co-design approach into actually having a system that's designed for the people who are actually using the system. Next slide, please. We do have a full report, and I believe CDTRP has it as a collection in their resources, but feel free to reach out to Manuel or myself of how to access it. And we have in detail the mindsets and the approaches, and even more details about how we went about co-design and a few, fuller description of sort of the challenges and opportunities that we see with co-design, and a lot of really great appendices as well that hit on specific aspects of engagement, things like compensation, things like recruitment, all those things that we know that can be challenging, but also like some great opportunities to shift the way we approach it. So this is my little plug to reach out and read the full report. So thank you for having us.
Wow, that's an amazing collection of work you've done there. It's really interesting. You mentioned some interesting phrases that just sort of popped out. In the world of Google, you think about big data, and you changed it to deep data and deep thinking, and I don't know. I just somehow that just strikes me as so meaningful, so meaningful.
Thank you.
So I'm opening the forum to any questions. If anybody has any questions they'd like to ask, feel free to post it or feel free to raise your hand. Maybe I can get started with one. So out of all of this work that you've done, what's the most surprising thing that you've discovered in your findings or experience? And I'm not sure who I'm putting on the spot here. Maybe Sarah? I don't know.
I can start to
Okay, Nadine.
not put her on the spot. I think the most beautiful thing for me is when we opened up the space for co-design and sort of the possibilities of co-design. I don't think I imagined that the excitement and hope that policy analysts as well would have. And so there was really what we learned is the way that people are working feels good for no one. showing up to these meetings where you're rushed, where you can't be your whole self, where you're feeling data is extracted from you. People, policy analysts are also feeling that, right? So there was actually a lot of commonality, and that felt very hopeful for me. We spoke to a policy analyst who said, you know, I am a person with lived experience as well. I'm not just one role. I play both roles, and I don't feel like I can show up from that point of view, because or else I'm seen as less professional or not of an expert. And so this work really challenges that, and that felt very hopeful for me, that it's a solution for everyone to sort of, when we design for a few, we can actually solve for everyone to have more meaningful relationships.
Yeah, it's human. It's all about being human, right?
Yeah.
Yeah.
I
Sarah, do you want to add
agree.
anything?
I would love to. Yeah. And I think just even one of the mindsets too is sort of like goal driven versus process driven. And I think being in government, it's sort of this idea that it's all about the output. It's all about the thing. It's the artifact that you come up with at the end, which, yes, that's very important. But it was surprising to me to see sort of the power in just these co-design sessions themselves, like the ability to like have deep conversations, the ability to build trust, to build relationship, and even to not necessarily always come to consensus on everything, but just the power and the healing, I think, that some of these experiences can be, especially, you know, earlier we talked about like the harms that have been done by government before. And it's sort of like, how can we create spaces to sort of begin again and start new? And so I think like having more focus on like just the process of engagement and the benefits to going about it in a more inclusive way, and not just solely focusing on what is going to be the output of these workshops, like what will the report look like.
Absolutely. Manuel?
Yeah, Lynn, I can jump in there and really build and echo what Nadine said about the role of the policy analysts in this work. Going into it, I mean, I was unsure, let's call it unsure, of how, you know, folks working in government, policy analysts in particular, would work with this space. You know, it is somewhat out of the box thinking and going into this work. And, you know, I mentioned earlier, co-design and these different pieces. I was really pleased and maybe surprised. Maybe I'm not giving them enough credit, but really pleased with how receptive they were to work, and really speaks on the pieces that Nadine spoke about, you know, we're all kind of struggling in certain spaces. I really appreciated that aspect. Yeah, I think I'll leave it at that.
Okay, that's fair. So let's hypothetically say someone has a project and they want to get started with co-design. Where do you begin? What's step number one?
Well, I'll put a plug in for CDTRP here, of course. I mean, certainly for anybody wanting to work in patient engagement or kind of follow the processes of co-design. I mean, that's what the PFD platform is here for, and certainly myself as the point person for that work, happy to discuss and kind of go through this process. As I mentioned, I purposely mentioned earlier, it's an iterative process. We're working through this together. Getting patients there right from the beginning. You know, don't engage me when you're, you know, for example, halfway through your project, or you're just about to submit your grant, and now you're looking for patient engagement, right? So come to me at an earlier stage. Let's work on this together. The full report has fantastic recommendations. I can't recall how many there were. Sarah, Nadine, maybe I think it was in like the 40s or 50s amount of recommendations. One of the things that I shouldn't say surprised about, but one of the pieces that really hit home is when I looked at those final recommendations. You know, a lot of that were core principles that we incorporate at CDTRP with respect to patient engagement. So it felt validating to see that a lot of the principles that we follow were reflected in this external project that you know, that was led by Health Canada. So for CDTRP members, come to us and CDTRP, we're happy to support. But specific to this project, I will pass it to Sarah and Nadine to talk a little bit about
that. I guess I would say, do your research. You know, I think sometimes too, what we heard from people about meaningful engagement is sometimes what can right away affect trust is that maybe you're engaging on something that people have already been engaged on many, many, many times over, and you haven't done the work to go and look at what they said in the first place. So I would say before you even start thinking about what engagement, think about why your engagement and what work has already been done in this space, and do your homework. And then secondly, I would say then build your team, right? Like, and right away talk to somebody with lived experience, and right from the beginning, right from the design, just bring people in right then and there. Don't sort of, finish your perfect project proposal and wait till it's all, written in stone and then start bringing people in. I would say be vulnerable, show the messiness of it, show your drafts, show your work. Like, the more transparent you can be from the beginning, I think really helps with just the making sure that you get the design right for the people that you're meaning to engage. And also, again, like going back to having that trusting relationship and that you are true collaborators, because you're not coming as the poised, perfect, expert. It's like, no, like, I'm going to open this up and we're going to actually do this together from the beginning.
Fair. I have two comments in the chat here. I personally, from Sean Delaney, I've personally found, especially on projects in basic bench research, many researchers feel part of but not connected to the donation/transplant world that they are supporting. Co-design definitely opens a great way to bring those researchers many steps closer to the bedside from the outset of their project inception. Absolutely makes sense. And I have one from Anita. She has a question. Can you talk about how you perceive barriers to the co-design paradigm, or moving away from an outcomes focus? Sarah?
Sure. I was looking at Nadine, but I'll start with the first thing that popped in my head, but I know Nadine has more to say on this. I would say for me, I think in my context, it's time, right? Everything is, you have to follow the budget cycle. You have to follow the time. You have to, if you said you're going to have your draft by January 1st, it better be done by January 1st. And it's hard to go to your, director, your director general to say like, well, we needed more time to build relationships. So you're not going to get my report till February 1st, right? It's hard to plan in that sense. I would say that is a sort of perceived barrier, but I think in reality, like I said earlier, we are not that fast in government. So really looking at like, where are we spending our time and where should we be spending our time? And you actually creating longer timelines to invest in relationships and to invest in co-design, rather than, some other things that that are slow for the sake of being slow. So for me, in my context, that's definitely a perceived barrier that I think we can overcome with better awareness.
Yeah, just building off Sarah, there's the idea is also, if we invest early on, the outcomes will be more relevant, right? In a way, by focusing on the process, you actually get better outcomes. And so it's a bit of a mind shift, but if we can actually invest in time in building something, then you're not just recreating the same thing next year because it fell flat, or people don't want to be engaged. People don't want to be part of your research ever. And I think we've actually done some workshops with policy analysts on these mindsets, and people have a lot of concerns, or how will I do this? And we often speak about change can happen from top down, and like big change happens that way, but often change also happens bottom up, from just how you're showing up in a meeting or how you're structuring a meeting. Think of a meeting where you have 12 agenda items. Like, there is no space for complex dialogue, for people to share discomfort. What if you were to slow that down? Already that can be radical and a first step of opening space. It doesn't always need to be big macro change to start.
Okay. Fascinating information, fascinating session. Okay, let's move on to the next session for today, if we can. Thank you very much to Sarah, Nadine, and Manuel for all that hard work. But before we move on to our final workshop of the day, we wanted to remind you that if you would like to get involved as a patient, family, or donor research partner with the CDTRP, the first step is to fill out the online application form. The team is posting the links in the chat now, so feel free to click on those links, and don't forget to bookmark them. You can come back to them later if need be.